I'm here with Dr. Jeremy Schmoe, and he has agreed to come on here to talk about concussion recovery and improving your brain after having a brain injury. So, welcome, Dr. Schmoe.
Yeah, thank you for having me. I'm excited to be here.
Can we just get started? Can you just talk a little bit about what a concussion is and how there is hope for improvement? Because over and over again on Hope After Head Injury Online, I see people commenting like, if this will never get better, there's no hope. And
Mhm.
it's really hard when you're living with an injury that you've lived with for so long. It really does feel like nothing's ever going to change.
Yeah, so I mean, a concussion. There's all sorts of actually different definitions when you look out there. Everybody will say kind of something a little bit different, but for the most part, it's from a blow to the head. In my opinion, you don't have to have a blow to the head to get head trauma. I mean, you could fall and land on your shoulder, whiplash your neck, or fall down just going down the stairs, land on your butt. That force can go into the brain. So in my mind, anything that changes that integration going into the brain biomechanically, rotation through the neck, whiplash, like that can affect your brain, and it can affect the neurological circuitry and pathways, but it can also affect the neurochemistry and like the immunology of what's going on in the brain from an inflammatory standpoint. So with concussion, you have all of this kind of chemical soup, this inflammatory stuff that's going on, but then you also have all of this neurological circuitry stuff that's going on and the structural components to it too. So you can have whiplash and injury to your neck. You could have changes in the way that your eyes stay steady or move your eyes quickly, or like combinations of how your vestibular system integrates with your balance and your eye movements. But then on top of that, have the neuroinflammatory aspects of what's going on at like the cellular level, and how neurons and these glial cells in the brain all kind of communicate with each other. So there's multiple different components. And then with post-concussion, you can kind of break it down into different categories. So, I mean, you can have a concussion that's more ocular motor, so it affects your eye movements more. You could have post-concussion symptoms that affect more of just like your neck, like cervicogenic. You could have more that kind of affects just anxiety and depression. All right. And then you can have like physiological or like autonomic based symptoms. So I just think everybody is completely different with what happens to them and what happens to their brain, depending on a bunch of factors that went into how was their brain prior to the concussion, what actually happened, and then what their rest was like after, what kind of exercises they did after, like what was the rehab. And many of the people that we see are 1 year, 2 year, 5 year, 8 year, 13 year, post accidents,
Like
post
me.
injuries.
Yeah. I was 11 years
Yeah.
when I
And
came a year ago.
we're still able to make improvement. And, people ask me all the time, should I have came here like right away? And I always tell people it's your journey after you have an injury. Sometimes you're meant to see, this therapist or do this first prior to do something. It's just the way things work out sometimes. But, we like to just get an overall global look at how is your brain function when you come in, no matter if I see you 2 months or 6 months or a year or 3 years or whatever. We're going to look at your balance, graph out all your eye movements, look at how your autonomic function is, assess you structurally, run labs, and look at what's going on from an underlying metabolic standpoint. Do you have anemia? Do you have an infection? Do you have inflammation? There can be these metabolic things that are going on in addition to your structural and your injury stuff that could affect your recovery. So I think the main things that I see with patients that are kind of slow to recover is that there is something metabolic, or there's this kind of complex central vestibular issue that's going on, and it's affecting the structural stuff. Initially, people obviously have pain and things going on with their neck, and then they get multiple therapies that are directed towards that. But what I see with people 3 years, 6 years later is that there is something going on with just the connections between their head and their eyes and their neck. and you need to go after those first and get that integrated, and then perform manual therapy and things of that nature. So
Yeah, I mean, that definitely makes a lot of sense to me because a lot of what you're describing has been my personal experience with my brain injury and multiple concussions. Um, it's just crazy because I didn't even know about so many of these things until even last year when I first came to see you and when I first met you at the brain injury conference,
yeah,
because I'd been living with vestibular issues since my TBI that had gone completely undiagnosed and under the radar. And so I spent over a decade just constantly struggling
hmm
and not understanding the root of it and just thinking that was just how it was going to have to be.
yeah. I mean, and many times, people just have overall just general fatigue. I mean, fatigue is huge. Headaches are huge. And then the therapies are directed at, well, let's do cognitive rest or let's restructure our life to, you know, kind of deal with that cognitive dysfunction. But really, there's this underlying issue because the brainstem got concussed, and there was force that went into that area of the brain that changed that circuitry, and then that's kind of derailing and taking away all the energy from your higher cognitive function. So that's one of the most common things that I see in patients that aren't getting better is that there is a change in their brainstem integration, and we need to figure out exactly what that is. And there's different levels of the brainstem, so somebody could have more of an issue in the upper brainstem, in the midbrain, versus the pons or the medulla, and you'll have different neurological symptoms. For the most part, if you have issues more in that lower brainstem region, you're going to have more autonomic symptoms. And
Mhm.
that was really your case. I mean, so there was a lot of dysautonomia. I mean, your tongue was weak when we actually did muscle testing with it,
I forgot that. Yeah.
Yeah. So the nuclei for the tongue, the hypoglossal nuclei, that's in the lower brainstem. And then you had a head tilt. All right. So you had one eye that was higher than the other. And we did a test that's called a Maddox Rod Test, where it actually looks at the vertical deviation of your eyes. And one of your eyes was higher than the other, and the other one is actually sitting lower. So when I see that and I see autonomic symptoms, like, being very dizzy, going from seated to standing, which you had, and headaches, there's some underlying autonomic dysfunction. And going in and just adjusting the neck or doing muscle work or even just doing VOR stuff and moving your head all over the place can actually make things worse in some cases. And we need to figure out how much that person can tolerate and do therapy up to that point and not push them past their limit, and then just keep building it up and building it up. So whenever you see this kind of central vestibular dysfunction, in my mind, you have to kind of address that first and address the autonomics, and then you can move on to working with structure. And then if we need to do more types of visual based exercises after, then we can do that. So I think, everybody kind of has their own kind of hierarchy of what they need, but what I just said right there seems to kind of translate over to many of the patients that I see.
Mhm. And I think you bring up a good point when you're talking about how everyone's different, because that's one of the things that I think when you're in the brain injury community as a survivor or throughout, you realize that everyone's experiences are different, but you have similar things
hmm
that kind of link you together. But so, what hope can you bring to brain injury survivors? Somebody's watching this. What hope can you bring about the brain's ability to heal? And
Yeah, I mean, in your situation, I mean, we made changes within like a couple days. So you start objectively seeing that, hey, your reflexes were better, your balance looked better, your gait looks better. So if you do the right things at the right time, like you can make changes if the person's system is ready to make that change and integrate and adapt. So with us, when people come and see us, we basically see them over a short period of time because we're trying to make those changes.
Mhm.
And during the week, if you see those changes, then it's like, all right, this is going to be good. and people are going to continually do their exercises to keep building plasticity down the road. And then if people, for the most part, if we do the right stuff, we see improvements in a short period of time.
Yeah, I can attest to that for sure. And
Yeah.
it's amazing because the brain has, I think one of the main takeaways that I had from a survivor, like non-medical perspective, is more so like the brain has the ability to heal, and your
Mhm.
neurological pathways can heal. And so many times people just resign themselves to not being better. And I think there's a fine line between accepting living with a brain injury and accepting some of the difficulties and giving up. And I always try to encourage people, don't give up on your recovery and don't give up on your healing process, because yes, there is an aspect of understanding that brain injury is part of my story and it's part of who we are. But then there's also the side of, now let's keep hoping and moving
Yeah.
forward and finding new opportunities and seeking out new treatments and therapies, because there is hope for further healing beyond what you might even be able to see now.
Yeah, so I mean, I really feel like with functional neurology, like we kind of set the stage of getting your system integrated back together. And then, people do need to do other therapies in some cases. You might need vision therapy, or you might need to do some sort of dietary change, or do some cognitive rehab. I see us just kind of setting that foundation of getting your brain like in the right place to be able to just go on and just move on and do other things that you might need to do. In some cases, though, I mean, we fix people in a short period of time, and we
I
make
mean,
some.
I can, like, one of the tangible things is after seeing you, I didn't need my prism anymore. I've been wearing a
Mhm.
prism in my glasses for 4 or 5 years. It was ground into my glasses, and after seeing you, I didn't need it anymore, and I haven't needed it since then,
I
like
mean, so we
instantly.
have we have stories like that pretty much every single week here in
Yeah.
our office, and we like to follow people afterwards too, and just like keep up with them and make sure that they are getting better. If we need to change exercises, then we can change that.
Hmm.
One of the cool things that I've done, and I should send this to you, but I developed this kind of telehealth like assessment. So if somebody is like, do I need to change my exercises? They can just do it at home and then send me the results. And then I could go, oh, change this, change this, change that. Because as your system changes and improves, like you need to make things harder,
Yeah.
basically. You need to add in like some complexity and start with that. But we always start with just basics here. It's like get your autonomics better, get your balance better, get your eye tracking better, help with that central vestibular integration. And what you see for the most part is that you'll see your cognition will start to come back online. And then we start giving you cognitive exercises and training and things to do. If you try and do all the cognitive stuff when you have all of these other issues going on, then that's usually difficult. So if you have a hard time just doing, standing in place, or you feel rafty, or you feel floaty, or you feel dizzy and you feel nauseous all the time, like how are you going to be able to think? All
Yeah.
right. How are you going to be able to, use your higher level cognitive function and processing? So that's kind of my order. Get the autonomics better, get central vestibular, start dealing with the neck now that the eyes are more steady, give eye exercises, get people's gaze stabilization better, get their quick eye movements better, get them able to basically follow targets and then tolerate like motion and movement, and then move on to doing more complex like cognitive tasks and like dual tasking. And that's one of the things that we saw with you actually was, I don't know if you remember this, but you had issues with like dual tasking, like doing two things at once and like walking.
Yeah.
All right. So when you see that, we need to get this underlying circuitry to kind of a baseline to allow us to keep moving forward. And I think that's a pretty good recipe for getting people better right there.
Yeah. That's great. Yeah. That's so great. Do you have anything else to add on just bringing hope to brain injury survivors?
I mean, just I would just say never give up. Uh, there's always something else for the most part that's going on that can help you get to that next level. Even if you're like, all right, I feel like I'm close to 100%, there still might be other things that we can uncover that can basically help you even get to a higher level. So I think it's worth seeing a functional neurologist and getting an assessment and just integrating that in with whatever other therapies that you're currently doing. So if you're doing vision therapy or you're doing vestibular, yeah, the things that we do seem like we're doing vision and vestibular, but we're kind of trying to put all of the pieces together, and adding somebody in that does what I do can be a really good thing. So
That's good. Thank you so much for taking the time to have this conversation.
no problem. And if anybody wants to reach out to me, you
Mhm.
just can go to my website. It's just thefnc.com. You can even email me directly. It's Dr. Schmoe at thefnc.com, and I'll most likely get back to you and take it from there.
That's perfect. Thank you
Okay.
so much.
Yeah, thank you.